الاخبار يا جماعه، عاملين ايه؟ معاكم عمر وفيديو جديد من سلسله اكيد هتتعلم حاجه من الفيديو ده. الفيديو ده هيبقى معانا انترفيو جديد بطريقه تعلم انجليزي مختلفه، وطبعا هنعرف ايه اللي حصل مع الشخص دوت عشان يوصل لمستوى الانجليزي اللي هو وصل له دلوقتي، وايه الاخطاء اللي عنده علشان نقدر نستفيد منها في الفيديو ده. فلو انت جديد في القناه ولسه ما اشتركتش، ما تنساش تعمل سبسكرايب وتسيب لي في الكومنتس دلوقتي حالا باللي انت عملته في حياتك علشان توصل للمستوى اللي انت فيه دلوقتي في الانجليزي، علشان نعمل الانترفيو الجاي. وطبعا ما تنساش تكمل الفيديو ده للاخر علشان هتستفيد منه حاجات كتير جدا، ولازم هتتعلم حاجه. ويلا بينا. انا كنت بدرس انجليزي في مدرسه بريطاني لحد اعدادي، بس بعدين سبتها ودرست بالعربي، وبعدين دخلت الجامعه، فعايز اعرف مستواي ايه دلوقتي. تعال نشوف. اسماء, tell me more about yourself please.
Okay, my name is Asma. I graduated from Faculty of Pharmacy in Cairo University, and I'm currently working as a pharmacist in Bahrain.
Okay, right, fantastic. And what is the difference between working as a pharmacist in your home country and in Bahrain? Can you tell us?
I didn't work in my home country in Egypt. I just got an internship there, and it is a lot different. One of the differences is that in Egypt, many people and many patients come to the pharmacy instead of going to the doctor or a physician, and they trust a pharmacist to treat them or to give them the right drug. I don't think that's very right to it's right to go a pharmacist in all like in all cases or in all patient cases, but pharmacists can do a lot of work and can help a lot of patients, but some patients need to be referred to the doctor. In Bahrain, people have the culture of going to the doctors more than to the pharmacist, and they go to the pharmacist in very few cases to get if they have cases like cold and flu and things that are not very complicated, so they can go to the pharmacist.
So, what do you actually recommend? Like, if I am sick, and I'm super sick, and I'd like to see someone now just to know what the issue is. So, what is the very first stage I have to go through? Like, do I have to go to the doctor, or I have to go to the hospital, or I have to go to the pharmacy?
It's actually according to the how do you feel?
How do you feel? The L here is dark, so you don't say feel, you say feel. How do you feel?
What are the symptoms that you are facing? For example, if you are having very bad symptoms, you should go to the doctor, or you should go to an emergency hospital, emergency room in a hospital. But if you are having normal symptoms like stomachache or fever or some things that are not really complicated or needs a doctor, you can come to the pharmacist. And if the pharmacist felt okay, you need to be referred to the doctor, we will inform the patients about that.
So you just go to the pharmacy, just, to explain to the pharmacist what the issue is, and then if you are to be recommended to go to the doctor, you have to go to the doctor straight away for sure, yeah?
Yeah, exactly.
Right, so the culture of the people that you are currently dealing with is super different to the culture of the people that you could have maybe the people that you could meet in Egypt. Maybe that's why you would much rather stay where you are at the moment, yeah?
Yeah, the culture is a lot different, like I told you.
Well, yeah, I'm trying to compare between the culture of the people that you might have met here. I'm not really sure if you work as a pharmacist here at all, but you work as a pharmacist at the moment in the country where you are in Bahrain, and presumably you do like it. By the sound of it, I'm sure that you do like it. So what I'm actually presuming, or what I'm actually, trying to get my head around is, what do you make of the culture over there? Like, when you talk to someone and you say, do you know what, you're going to have to go to the doctor because we're not going to be able to help. what do you actually make of it? Like, do they understand and they say, okay, no problem, we can go to the doctor if that's very dangerous? Or maybe they are like, no, just give me any sort of treatment and I will be okay with that.
Like most of the patients, I can say like they refuse about going to the doctor.
They refuse to go to the doctor.
They think that it's not a big deal.
Deal, not deal.
So just give me anything to relieve my symptoms, and if I felt like it's getting worse, I can go to the doctor.
One last thing here. You said you studied at a British school. Am I correct?
Yes.
When you say British, do you mean British teachers or British curriculum?
No, British curriculum, not British teachers.
Okay, so that's not British at the end of the day.
Yeah, like the curriculum is British, so it's called like a British school, but the teachers and all the teachers over there are Indian teachers, and they are excellent. But I didn't get the British accent from them.
Okay, nice, no problem. So, was that in Egypt or that was in Bahrain as well?
No, it was in Bahrain. I lived most of my childhood in Bahrain, and then I went to Egypt after high school to earn my college degree in pharmacy, in faculty of pharmacy.
So, Asma, I'm very happy to have a chat with you anyways. Your English level is B2 at the moment, which is absolutely fantastic. اوكي، طبعا بناء على الكونفرسيشن ديت قدرنا نحدد مستواها انه يكون B2 في الانجليش. طبعا بعد ما عدلنا الاخطاء من ناحيه البرونانسيشن وغيره، فمستواها B2 في الاخر، ويعتبر مستوى كويس يعني مش وحش. لو انت لسه عايز تحدد مستواك وكملت الفيديو للاخر، ما تنساش تسيب لي كومنت دلوقتي حالا وتقول لي عملت ايه في الانجليزي عشان توصل للمستوى اللي انت عليه حاليا. ما تنساش تعمل سبسكرايب، واشوفكم في فيديو جديد.